Hello everyone. So are diabetic patients at increased risk of development of diabetic foot ulcers? And amputations more common in diabetic foot patients? Hello everyone, this is Dr. Jayaditya, Endocrinologist at Yashoda Hospital, Malakpet. So yes, in diabetic patients, what happens in long-term diabetes, there is development of diabetic neuropathy. So what does diabetic neuropathy do? So if the patient develops neuropathy, they may have certain positive symptoms as well as negative symptoms. The positive symptoms are in the form of burning sensation in the feet as well as tingling sensation in the feet. They can also develop negative symptoms in the form of numbness. So when the patients develop negative symptoms, they do not have much sensation in the feet, and even if they have some trauma to the feet, they may not realize these trauma. And therefore, even if they develop small lesion in the form of ulcer in the feet, that may go unnoticed and they can increase over a period of time, developing more larger ulcers. And in diabetic foot patients also, there is also associated peripheral arterial disease. So what does it mean? It means that there is decrease in the blood circulation in the feet. So compound effect of both diabetic neuropathy as well as peripheral arterial disease, there is increased risk of ulcer formation, as I had said. And even small ulcers which are developed because of unnoticed trauma can increase in size because of the decreased circulation of blood to the feet in diabetic patients because of the peripheral and arterial disease. So ultimately, these ulcers can develop infection because of increased blood glucose level, and the healing is also impaired because the blood circulation to the feet is not properly there. So ultimately, these patients land up in amputation. So the amputation risk is very high. The other important thing to be noted is that in patients who are having peripheral arterial disease, they are at increased risk of development of cardiac disease as well. So ultimately, these all things are interrelated. So we should take proper care of the feet. And how to prevent this foot ulcers and amputations? We should always wear a proper footwear. We should not go in diabetic patients. It is mandatory to use a proper footwear which actually fits the shape of the foot properly. So we can ask them to wear a sandal kind of a shoe which has a strap from above as well as from behind, and also they can use a thick sole with a soft cushion that will help them prevent development of ulcers, and it can also prevent development of trauma-induced ulcers in patients. Apart from that, they should daily wash their feet with soap and water. Normal water should be used, not very hot water, because sometimes they do lose the sensation of increased temperature as well. So if hot water is used, they can cause burn in the feet as well. So they should be also cautious regarding it. Apart from that, they should also apply moisturizer to the feet daily so that dryness of the feet is avoided, because if dryness is there, they develop cracks that can be the entry points of infection as well. So if the patient follow these steps, and if the patient also have a proper footwear hygiene, as I have said, this can prevent the development of ulcers, and ultimately these ulcers are the starting point of amputation. So if ulcers are prevented, then amputation will also be prevented. So this is very much essential for patients who are having type 2 diabetes for long duration, uncontrolled diabetes, because they are at increased risk of development of diabetic neuropathy as well as peripheral arterial disease. Both are very important in the increasing incidence of ulcers and poor healing of ulcers as well because of decreased blood supply. So this should be very much taken care, while diabetes is not only about the controlling the blood glucose, but also the other things like improving the foot hygiene that can prevent the development of ulcers as well as amputation in the long run. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.